Hello friends, very good afternoon. I'm Dr. Soumen, Cardiologist and Electrophysiologist in Apollo Hospitals, Hyderabad. I've been working at Apollo Hospitals for the last 3 years, and we're going to be walking you through some clinically relevant topics today. First topic of discussion will be chest pain. Important to realize here is not every chest pain is a heart attack, and that's so true actually. It's very relevant in modern times because chest pain is something which evokes immediate fear and worry and anxiety, and it many times patients just trigger an alarm bell and they come down to the emergency. It creates a lot of panic considering the importance associated with chest pain. Now, not every pain is in the chest area is to be taken very seriously, or it is concerning, because we got to factor in that in the chest area apart from heart, there are so many other structures or organs. There are lungs, there are bones, there are joints, there are muscles, there is fat, there are nerves, and there is a food pipe which is called medically esophagus. So pain can technically and does arise from all these structures. For example, somebody who has a gastritis or esophageal reflux disease, as many people do have, they have a heartburn or so-called retrosternal burning, this central area, which can closely mimic chest pain or even a heart attack. Similarly, many patients who have recovered from COVID or any viral illness, they can have inflammation of membranous structures around heart and lungs, and which is called pericarditis or pleuropericarditis, which can again sometimes be very concerning and cause a serious doubt in patient's mind. Similarly, patients may have joint pains or vague muscular pain. Sometimes vitamin D deficiency can cause costochondritis and severe musculoskeletal discomfort. All of these can mimic chest pain. That's why it's a fact that about 5 or less than 5% of chest pain that we see in an outpatient is actually seriously concerning. So how do we understand what is really concerning chest pain, or what is angina? Angina is supposed to be very specific. This word describes the chest pain which is arising from critical narrowing of the heart arteries. Now, angina has a few very specific features, and it has some characteristic signs. Most importantly, there is a risk factor to go with. Generally people are elderly, they have some risk background, although we are seeing increasingly in modern times with that young people are increasingly having heart attacks and they are not immune to heart attacks. Having diabetes or extremely a stressful life, poor sleep hygiene, bad food habits, overweight, obesity, hypertension, smoking. These are a few risk factors apart from genetics and family history that tend to predispose patients to heart attack, cardiac illnesses. So apart from the background, the characteristic of the pain is rather peculiar. In people who have heart attacks or chest pain arising or angina, it has always a very central location. Unlike people always think the left-sided chest pain is rather significant or sinister. That's not true. Chest pain which arises from heart-related ailments is usually very central. We describe it as retrosternal, and it is generally not a pain. It's more of a discomfort or a suffocating kind of a feeling. People often describe it or characterize it poorly by saying that they feel heaviness, or as though somebody has put a boulder on their chest, or there's a tightening grip around their chest. So it's not very comfortable. At the same time, they may not necessarily characterize it pain. Now, if somebody says that I have chest pain with a single finger pointing at a point, that is it excludes heart ailments. Angina never is very local. It's not pointed. It's not one point. It's very difficult to localize at one. So that's unlikely to be angina or related to the heart. Similarly, sometimes when you have these angina or heart-related pains, you have this pain radiating to the left side or left shoulder. Sometimes it can radiate to the arm. Again, people have understood about this, and they've read it, they've found it in Google, they've found it in textbooks, they found it with discussing while clinicians, and wherever they start having some pain around the left shoulder or arm, again there's a trigger, there is a worry, there's a concern that is this heart attack, and they come down to the clinics and emergencies considering that is a heart attack. Again, you do have mimics. You can have shoulder issues, you can have neuropathies, you can have muscular pains which can have. So generally, if you have angina, you tend to have, which the common factor is chest pain, which is retrosternal. It is central and it has radiation. If you have only shoulder pain and no chest pain or no central pain or pressure, is unlikely to be related to chest. So the point I'm trying to make here is do not raise the panic button as soon as you feel something in your chest or there is something, because not everything that arises from the chest is related to heart. Although it's good to be conscious, it's good to be aware and good to worry about heart, but that worry should be rather directed towards good healthy practices, practices which are good 1,000 years back, that is good food, good lifestyle, good proactive physical activity, good habits are still good, and they go a long way in preventing cardiac ailments, which I think is a better way of addressing these problems rather than thinking about your LDL cholesterols, numbers, pulse rates and BPs and all that and whatnot. So these things I think are more pertinent in when somebody is assessing his or her own symptoms.